And today, our speaker, Avery Smith, he is going to talk about artificial intelligence and Black health. So Avery started coding way back in 1999 as a hobby to promote his graphic design. In 2003, he earned a Bachelor's of Visual Arts in Graphic Design from the University of Maryland, Baltimore County, UMBC. Also, former President Hrabowski was there. And in 2006, he earned a master's in e-commerce development from American Public University. And in that master's, it included e-commerce, database development, web programming. He also has extensive software development expertise through his work with healthcare.gov, the US Small Business Administration, the Library of Congress, and the Smithsonian Institute. After his wife passed from skin cancer back in 2011, Avery sought ways to use his software engineering skills to improve the health outcomes of people similar to the family that he had lost. Thus came Melalogic, a platform that empowers Black people to be their own healthcare advocate through nuanced education, behavior modification, and clinical support on improving their skin health. Avery envisions Melalogic to use image recognition to help pre-diagnose skin conditions in people with darker skin tones at its earliest stages to lead to lower mortality rates. So Avery, thank you for joining us today. And we really look forward to your presentation, and feel free to put where you are from in the chat. And thanks, Avery, for being with us today.
Oh, you're welcome. Thank you. Thank you very much for having me. Thank you so much. Let me go ahead and just share my screen. All right. Can you see?
Looks
all right,
great.
wonderful. Wonderful. Thank you so much. So, yes, my name is Avery Smith, and I am a software engineer. I want to make that very clear up front. I'm not a machine learning engineer. I'm a software engineer, and just overall, I'm a person that's very curious, and I like to solve problems. I've been in computer programming since 1999, so it's 23, about to be 24 years now. It's been a while, and it's been a great ride. I'm also a researcher, and I am widowed. My wife passed away in 2011 from melanoma, which is the most dangerous form of skin cancer. And it was during that time where I really learned a lot about caregiving, and I learned a lot about skin cancer, cancer in general, and also the healthcare system. Prior to that crash course, I had no idea what it was like to go through a hospital situation. And but after having coming out of that and seeing my wife, how she was treated and cared for during that time, I learned that, wow, survival rates really do fall down racial lines. It was an eye opener for me. So since then, I have because of the kind of person that I am, I sought to figure out, well, how can I combine my experiences to make a better way for myself and for others? What is the kind of thing that I wish existed at that time? And if it had, maybe she'd still be here. Who knows? And for those who are in situations right now, how can I make it so that other people don't necessarily have to have the same experience, tragic experience that I had? And so what I discovered is I discovered information on how skin tone it makes a really big difference when it comes to the kind of healthcare that we receive. And I just want to start off first by just going into what skin tone is. And humans, we come in, we're wonderfully made, we're unique, we're very creative, We solve a lot of problems, and we live all across the world. And we come in a variety of hues. We come in a variety of colors. And the truth is that color that we come in is a form of red. We're all variations of red, from the darkest of brown, which is brown is really a dark orange, which is a combination of red, yellow, and black, all the way down to the pinkest of pink, which is red with white. But we're all, as humans, a variation of the color red. And yet how we have tended to categorize humans is not necessarily like that. The way in which that we've categorized humans, and I want to give credit to Angelica Das, who's the photographer of these beautiful photos. She has this project. She has a project called Human A. And so I just wanted to make sure that she gets credit for these photos, because that's where in which I got the photos from for this presentation. So we tend to categorize humans in these broad buckets. And what are those buckets? We know them like the back of our hand: white, yellow, red, brown, and black. And if you get fancy, olive. But it's funny because when I see olives, they're typically black or green. So I don't know if anybody's seen any green people walking around. Let me know. Maybe that makes sense for olive. But the point is that we have this broad categorization of color labels. And if you actually look at somebody who is supposed to identify with that color, they look nothing like that color. And where does this come from? This comes from a white Eurocentric point of view by the name of a gentleman. I don't know how gentleman he is, but a guy by the name of Johann von Blumenbach, who came up with this color categorization not too long ago, about 200 years ago or so, 1700s, maybe 1800s, something along those lines. And it was his way, and it was his way of trying to understand the world around him. And then by extension, that caught on. And these are how these color labels became popular. Now, the thing is that was a approach for a form of labeling, categorization, people grouping, and census accounting. And unfortunately, though, that these labels started to, as things happen, started to influence political decisions. And then from political decisions, different areas of people activity, such as nation building, such as real estate. So and then healthcare is another part of it. So policymaking, it also influences healthcare, and all this stuff comes from just a particular worldview that was not necessarily based on science, but it was just based on trying to understand, trying to group people together to create, to do a form of othering. And we can see that we are, when you actually remove those color labels, that we all are pretty much, again, a variation of the color red, really forms of browns, pinks, but the base color that we all are is red. And so I'm showing you this just to kind of demonstrate just how ridiculous the color labeling system that we tend to practice go by, from calling somebody white all the way across to calling somebody black. There are no actual black people walking around. They're just variations of the color brown. And now that we've talked about just how imperfect the color labeling system that we tend to practice, that we tend to use is, I wanted to just show you this world population by racial category according to the color categories that we were talking about. So we can see here that people who would be categorized as Black are 21.9%, and then people who would be categorized as white are 21.9%. But this is the thing about how silly these color labels are, is because there is no clear broad line, because the people who are distinctly white European are a small percentage of the world population, but because of politics and nation building, so on and so forth, this white calculation also includes people of South America. And yet at the same time, when you count people as brown, that can also include people in South America. So brown would include people of Indian descent, but people who tend to be categorized as brown can be darker than people who tend to be categorized as Black. So these numbers really don't make much sense. So I just kind of wanted to show you how unclean these categories are. Now, getting into the health impacts of these unclean of this categorization. While we are all variations of the color red, because of the impact of the color combination system, and that impacts that. I mean, we know that it's racism. It is unfortunately, we have been greatly impacted by the practice of white supremacy throughout all aspects of society, the society that we live in, to include our healthcare system, and the research that has been conducted, and also healthcare protocols and treatments that have been created over the past couple of 100 years. They tend to they impact our survival rates across racial lines. And the thing is that we have if you see here the numbers of the survival rates, melanoma is, for those unaware, the most dangerous form of skin cancer. And these are the, broadly speaking, survival rates within the United States of those who would have melanoma. And if you look, you see you have the white American male, which is a survival rate of 90.3%. Then the Asian American male comes after that. And then you have the Native American or red Native American male that would come in after that. So his survival rate is a little bit lower. And then you have the Latino American male, whose survival rate is lower than that. And then under everybody, you have the Black American male, who is the least likely to survive a 5-year melanoma diagnosis. And so it's just about the same with the white American female. The survival rate is about 94%. And then after that, you have the Native American, you have the Latino American female. And then after that, you have the Native American female, which is survival rate is a little bit lower. Then you have the Asian American female, survival rate a little bit lower. And then right under that, you have the Black American female, whose survival is least likely to make it through a 5-year survival rate of melanoma. And the issue here is, I think, pretty evident. So the question is what can we do today to make this more equitable? Just another chart here, melanoma of the skin. This is from cancer.gov. And this chart is a visual to show you what the 10-year survival rate of melanoma is, regardless of gender. And so it's just grouping by racial category. And you can see that that the non-Hispanic white is at the top of a 10-year diagnosis, and then the non-Hispanic Black is at the bottom of the diagnosis. So I just want to talk about, well, why is it this disparity? And these are some things that that have come to mind for me. And I think that part of it is systemic racism, as we've just talked about. The color labeling system of white, yellow, red, brown, and black. Want to throw olive in there or whatever. And a distrust of the medical system. I think that that's part of the disparity, which is rightly earned due to a lot of the poor practices that have been conducted that would make distrust in the medical system warranted, such as the Tuskegee experiment, the sampling without the consent of Henrietta Lacks and her cancer cells. I mean, slavery, anyone. So how healthcare part of the research that was conducted throughout the years of from dentistry to the practice in dentistry on Black people to the denial of professional recognition within the American Medical Association. All these things are warrant distrust in the medical system. I mean, even the spread in propaganda about not being able to trust Black doctors in the 1940s and the 1950s to Black people here in the United States. So a lot of that stuff, where you hear a Black person go to the hospital and say things like, "Oh, you hear your grandparents or your parents or whatever say, I don't want a Black doctor, give me a white doctor." Like, that's not just something that they just kind of came up with. That form of propaganda was promoted by the American Medical Association, to go into Black communities and tell Black people to not trust Black doctors because they're not properly recognized. So we also have patient population cultural taboos, such as hairstyling, nail styling, tattooing, these things in which that we tend to do within the environment, within the culture of Black society, that we don't really give much health thought or reasoning behind, actually do impact our health. The way in which that we style our hair, that's a huge thing, and it's a lot of misinformation that exists out here, even to this day, about how to best take care of our hair, but also the things in which that we do, such as locking our hair, certain styles, or its texture, how it forms. These things, hair is actually, it's a part of dermatology. It's a part of skin, just like nails. So there's a bit of a separation when it comes to our thinking within our environment about that, but that's actually all connected. And nail styling, tattooing, tattooing is very popular, but tattooing affects your skin. So imagine if you have a particular breakout, or if you're going to the dermatologist and you're dealing with a group of people or a profession that is unfamiliar with you and your skin and how it presents, that's one layer of complexity. But then to add ink for aesthetic purposes onto that, that's another level of abstraction and complication that goes into that. So then we have also pervasive stereotypes. Like it goes into something similar to what I was saying before about hairstyling, or how you're supposed to wear your hair or not wear your hair based on where you work and what you're doing. The Crown Act is one example of a bill that has been passed and adopted throughout different states within the United States that prohibits employers to prevent certain hairstyles from being worn. We know that tends to affect Black people very greatly. So also other pervasive stereotypes, such as Black people can't fill in the blank. For example, Black people can't get skin cancer, which is another way of saying Black people can't get sick, or Black people can't feel pain, or Black people can't get burned in the sun. Black people don't need to protect ourselves in the heat, like from the sun. All these things are not just things that the general population say, but there are also things that professionals say as well. I remember a nurse practitioner that I was speaking with one time out the blue somewhere, and she has said, "Oh, black people can't get skin cancer." That was a nurse practitioner that said that. So these stereotypes are very pervasive. And then also scant research, which goes back to federal dollars and private dollars that get allocated toward funding research that would impact and affect our particular or the particular group of Black people, certain kinds of illnesses, certain kinds of diseases, certain kinds of syndromes. They greatly impact people who are categorized as Black more than other people groups, such as vitiligo, which is it's a very common syndrome. It's an autoimmune disease, and vitiligo is dyspigmentation of the skin in patches. So it's something that we tend to know Michael Jackson suffered from, and so he used to wear a whole lot of makeup all over his body, wear body makeup to even out his tone. And then you have somebody that is more current, such as Winnie Harlow, who is a model who has these dyspigmentation patches across her skin. So vitiligo, while tends to greatly impact Black people, and yet there's very little research dollars and very little information that goes toward that particular healthcare issue. And there's also rosacea, which is kind of like eczema that presents itself differently the darker your skin is. Then you have melanoma, which we talked about earlier, even things as simple as curly hair, which is not necessarily a negative thing, a illness per se, but think about the products, think about the services that exist, and think about a lot of the information that's all on YouTube of people trying to learn how to best take care of their hair. That's all research that's being conducted on the fly, and there's not a lot of information that exists to the degree in which that it exists for people who happen to have white skin, and by extension, the way their hair typically is. So that's why I think there is a disparity, and this disparity leads to a gap, and this gap there's no convenient way for a Black person to access resources that'll display what a skin issue could potentially look like on them. And that's one of the things that I wanted to focus on, because it was very tactile for me. And that is, you've probably experienced this just in your life. And this is when you go to a doctor's office, or when you look up photos, or when online, or if you take a photo or a selfie, and or prior to 2016, and when Rihanna and Fenty Beauty came out, 2014, 2015, the lack of sufficient makeup tones that were available on the market, but that there's a big gap of being able to find examples of what certain ailments or anything that really had to center around the skin of people of darker complexions. How would it look? And so that's why I came out with what it is that I was working on, or currently working on. And so the question, I asked myself this question: how can we use technology, digital solutions such as AI, machine learning, data science, and the like, to guarantee that no person is mistreated, and guarantee that the person who needs help the most gets the most constructive help? And so I wanted to ask that question of myself, and of course to the listener as well. And I began to think about, well, I understand software and its potential positive impact because of it allows for scalability and precision. And I think that where we are, we're in a day and age. We're in a day and age where the days in which there's single ownership of applications, of solutions when it comes to our digital tools are pretty much gone. The single owner, meaning that, and I'm talking about incumbents or current large companies that exist, the solutions in which that how they're creating things, I think they're creating it out of a paradigm in which that is not as it's not as applicable, and it's not built for today, and it's not built for tomorrow. I think we're moving into a post-political age when it comes to the solutions in which that we're creating. And so what I mean by that is that I created Melalogic, which modernizes the skin health experience for Black people. And the reason in which that I could do that and am continuing to do that is because I can do it and other companies cannot necessarily do it, is because I think that well, one, I'm a Black person, so I understand the specific needs. I have a better idea of the needs in which of this particular group of people than, for example, a non-Black entity, because they don't necessarily have to deal with the consequences of this not working or failing. That's one thing, but also having lost somebody to skin cancer, I also know what it's like to that if this doesn't work, that there are very dire consequences. So it's not necessarily just like it's not just like a marketing angle, but yeah. So Melalogic is a platform that I've created that gives Black people a single source of skin health information from trusted professionals who look like them. And so the aim of it is to also ultimately empower a user to submit a photo of any skin issue they may have and receive instantaneous feedback as to what it could be and suggestions on how they should treat it. And I came across this information. And I just want to make sure I'm good on time. But I came across this particular opportunity because I was conducting research in 2017, again, combining my experiences. It started as an idea in 2016, and then it started to metamorphosize itself into actual strong validated concept 2017, 2018, and beyond. And it came about because I was working on I had another concept that had to do with hair. And I wanted to be able to identify different hairstyles just through a photo. And I had no idea how to do that. And I was talking with someone about it, and they said, oh, well, you know, there are these, there's this software that you can use, you can integrate it into your app. And I was like, really, you can actually do that? Because I didn't think that you could actually do it. This is back in 2016. And when I learned that I could, I said, oh, okay, well, actually, I think that I can use this to help identify different skin issues. And so I stopped the previous project that I was working on, and then I started to research this further. And right when I had came out with this, when I had this concept of being able to identify skin lesions through photography and machine learning, there was a research paper that came out at the beginning of 2017 with some scientists that were doing the same thing. So when that research paper came out back in early 2017, I said, wow, this is interesting. And the research paper was saying how there are a lot of the machine learning can identify skin lesions or melanoma or skin cancers, moles, to the same degree that a human doctor can. And it was a very popular article. And so one of the things after I read the article, I noticed is that, well, they didn't necessarily identify skin color in that research. So I called one of the researchers up and I asked the question. I said, hey, this is great. Really like what you're doing. I have a similar idea. Does this work on Black people? And then the researcher said, oh, well, yeah, that's actually what we wanted to do. Oh, it's going to be great. We wanted to work for all people, which was, I took that as, okay, so it's not working for Black people right now. I said, okay, great. I think I have an angle here. And so after I started doing more research about it, I discovered that much of the data that was available when it came to dermatology, 94% of it was white people. And the data was sourced, the images were sourced from Europe, the United States, and Australia, and they were predominantly white males. And so I said, wow, this is interesting. I think there's an opportunity here. And so I had collaborated with a Black dermatologist, and we conducted research about machine learning algorithms and healthcare disparities in dermatology. We put that together into a short research paper, and it ended up being published by the American Medical Association back in August of 2018. And so that's pretty much like how this ball started really rolling. And my goal with that was, because I could have just been like, oh, this is a great idea. Let me try to put together this app, this and this app, that. But I had learned, I said, if I can't get doctors to agree that this is a problem, then I might as well not even really go forth with it, because doctors are the gatekeepers, and I needed social proof. I needed this to be recognized by a respectable entity that this was a problem. And fortunately it was, because the research was peer reviewed and all of that. So if it wasn't a hair on fire issue or novel at the time, that it wouldn't have been published. And so anyway, from there, as you can kind of see, like, I'm not necessarily a machine learning engineer, but I do understand what's going on as far as the overall mathematical equations that are going on, and then also the impact if you can get this right. And so there's also, I want to say this, is that there's also a lot of buy-in that needs to happen, because this is where I think right now artificial intelligence is like all the rave, and it's a big trending topic. And much of that is a big trending topic, not necessarily because we are as far along as the news will make you think, but it is because of it's in the zeitgeist. I mean, it's pretty much chat GPT and stable diffusion. Prior to chat GPT being the topic of conversation, which came out at the end of November, everything was talking about NFTs. Prior to NFTs, everything was talking about crypto. So I think that the marketing, I think that the conversation is kind of almost outpacing the innovation, but that's okay, because we need the word really needs to get out about this. And the thing is, when it comes to data, is that it's not necessarily about having like the most data in the world, which I think this is where a lot of the big companies get this wrong. It's not necessarily about having the most amount of data. It's about having the right amount of data. And when it comes to the collection or the gathering, sourcing of the information or the data that's necessary in order to create a solution like Melalogic, then there needs to be an awareness factor and an underlying willingness from this particular community to be able to help contribute data in order to create this precision public health tool, is what I like to call it. And that's how machine learning works, is that it's about the input in order to get to an output. Because what happens is machine learning is, think about it like or image recognition as an image calculator. So not a number calculator, but an image calculator. So an image calculator, meaning that if you put this image in here, then it will then spit out the likelihood that this particular image contains A, B, and C, and it'll rank it in percentages. And it's up to you as a human being to determine whether or not that information is helpful to, or it's valid. And so when it comes to particular skin abnormalities, whether they be life-threatening or whether they be quality of life impacting, quality of life threatening, that we have to have the buy-in from this particular group of people, those who identify as Black, to then we have to have a mechanism for these particular people to submit or contribute photos of their particular abnormalities, so that we can then train, we can have the right amount of data to be able to train this algorithm to be effective. And so my last question, I'll leave it on this, is what you hear what it is that I'm doing, and I would like to throw that out and say, well, ask the question of what are you doing? What are you doing to help guarantee that everybody receives the right amount of help that they need and nobody goes mistreated? So you can kind of come and if you feel synergy with what it is that I'm working on with Melalogic, feel free to reach out to me about that and help. If you have a desire, and if you're working on something else, I want to encourage you to continue on with that. And if neither of those things are true, I want to encourage you to find something so that you can be able to answer that question, so that we can improve our Black skin health outcomes. Thank you.
Thank you so much, Avery, for that informative presentation. And thanks everybody for, yes. If you have any questions, feel free to either put them in the Q&A chat, and we will ask our speaker the questions. And thanks everybody for participating in the poll. And I believe that the poll will be closing very soon, so that way I can share them. And somebody put in the chat, how do they best connect with you? So what's a good way to connect with you, Avery? Is it through the platform, or what's it through?
You can email me at avery@melalogic.com, MELALOGIC.com.
Great. Yes. Thank you so much. And I'm just going to read out the responses that we have in the poll today. So we said, what is your status? And we have about 8 currently enrolled students that responded, and 29 graduated working professionals. So thanks everybody for joining us and putting the locations in the chat. So most of the students, so we have a few sophomore and seniors, and some master students, and a little bit more than PhD student. And for gender balance, we have about 59% female and 41% male. And where do you currently live? About half live in Georgia, and some people don't, many people do not live in Georgia. And we have a few who are joining us internationally. So thanks for coming today and hanging out with us. Love to have you join with us. There was a question. African Americans has the blank death rate for cancer overall. And the answer there is highest. So African Americans have the highest, was the most responded, and is true, the highest death rate for cancer overall. And that's a statistic that, and I totally agree, Avery, we all can contribute to changing. Number 6, Black people are blank likely to develop melanoma than non-Hispanic white people. However, Black people do develop the cancer rate, have a much blank 5-year survival rate. And so the first part is Black people are less likely to develop melanoma than non-Hispanic white people. However, Black people who do develop the cancer have a much lower 5-year survival rate. And about 38% of the participants got that one right. So thanks everybody for participating in the poll today. And if you have questions, you can put them in the Q&A or put them in the chat. And I definitely agree with one of our attendees today who said, an excellent presentation, informative. Thank you for sharing your knowledge. And one thing that I really do appreciate is that, oftentimes we're confronted with some deep, painful happenings, occurrences, and there's just, I can't really find the words to describe them. And it's very admirable how you took your pain and transformed it into passion to bring new data insights to other people. So tell us a little bit about what are some of the technological tools that you use? What are some of the methodologies that you use as you do your algorithm in your program? Can you talk a little bit about that?
Well, yeah, I can't get too much into the technical details, but I think one of the things that I'm working on right now is doing more so like networking. I'm conducting research with the general population and also with dermatologists to be able to learn how like to best determine like which information to collect, like what kinds of photos. Also, the comfort level of people wanting to submit photos. Like I'm really kind of at that point right now. So as far as like as far as the technical tools, there's I'm really looking at AWS recognition right now, but we haven't gotten really that far along with it. But that is a tool that is on my desk.
Fantastic. And you mentioned that, when we develop these AI models, we train them based off of data sets, in this case, images. And so if we don't have a variety of images, the models could be flawed, so to speak, not capture reality. So how do you navigate building that trust so you can get the data, in this case, get the photos, so you can build models that can bring insights for everyone?
Yeah, I'm glad you asked that. It's like it's a two-sided thing. It's about engaging the general population, one, but two, also engaging professionals such as dermatologists. It's both those things at the same time, because I could collect photos, but if dermatologists don't necessarily find it useful, then it's kind of like for naught. Then at the same time, I could be talking with dermatologists, right? And they may want certain things, but if I don't necessarily have like the flow of information coming in, then it's not helpful for them either. So it's really like a two-sided thing where, I mean, it's just having conversations like this, where the information is being shared to different hearers. It is getting out the door, GOOD, meaning reaching out to professionals, going to their practices, sending emails. And I also because a lot of the media attention that I've been able to incur over the past few years, there are people and professionals who happen to reach out to me who want to help. But that's kind of how I go about it. Also, building the trust, I guess, making sure that I can be as honest as possible about the approach, and not necessarily like aligning myself to like everything that comes per se, because I have to make sure like the things in which that I'm doing are somebody will want to put trust in it. So yeah, anyway.
Yeah, great insights. And somebody made a comment that Black hair care and skincare has been on the back burner, but it is probably the largest amount of money Black people spend on products. So, and yet, the financial allocation to looking for skincare solutions for Blacks, we have some work to do. Right?
Yes, I agree.
Yeah. And so someone asked, have you ever tried Azure or Efficient?
I'm sorry, what was that?
Azure or Efficient?
I'm not sure what that is. No, what is that?
So Microsoft Azure is a platform that people use. So they're just trying,
Azure,
Azure.
Azure, yeah.
Yes.
No, it's like Azure, well, that's new. I hope I know what Azure is. No, okay, yeah. Microsoft Azure, yeah. I'm not sure, what was the other one?
I don't know, maybe it's the Atlanta enunciation. Uh, I probably won't say that one correctly either. Efficient.
I'm not sure what that is, but as far as Microsoft Azure, no, not necessarily. That is an alternative product to Amazon Web Services. So it's another cloud computing vendor. But I typically utilize AWS, if anything, Amazon Web Services.
Okay, the person was so kind to
But
say that they're
but
using.
that
Mhm.
might be a product. That might be an alternative product inside of Azure. Maybe it competes with AWS recognition. Not exactly sure, but no, I haven't used that.
Okay, and the person was so kind to clarify. They said it's for image classification, training models, and she said it's provided by Google.
Oh, so that's in Google Cloud. No, I haven't used that.
Yeah, so many different tools to use.
Yeah.
The person they like it. Somebody else said, thank you. I'm a prosecutor all the way in California and found the presentation very informative, and will actually follow up because so many organizations need to see this presentation, because as you say, we all contribute to this, both on the technical side and also on the advocacy side, advocating either for funding or the prosecutorial side as well. So that's.
Yes, please reach out to me. Please send me an email. I'm looking forward to it.
Someone said they're curious about how the monk model might be useful for your work.
The Ellis Monk model,
Mhm.
MONK.
Yep.
Yeah, that's a very good question. Well, I actually Dr. Monk is a fan of what it is that I'm doing. So I reached out to him, had a conversation with him last year. And while I can't necessarily say that because he's got his own thing going on, so I wouldn't want to make it seem like he's a part of what it is that I'm doing, but his work has impacted, has influenced what it is that I'm doing. And the interesting thing about the Monk skin tone scale is that it's 10 categories, which is great. The thing is that there are other scales that exist as well that are different numbers. So or different amounts of tones. And so I like it because I think I like his because it makes things understandable to me for the general population, but for dermatologists, because he's not a dermatologist. He's a PhD and a researcher, but from what I found with dermatologists is that they kind of they approach things a little bit different. So it's not necessarily like a one-on-one thing between the general population and then the professionals with the Monk skin tone scale. But I do think that it does have a lot of value.
Nice. Fantastic. Well, I know we're coming up on the hour here, but I've really enjoyed your presentation and your insights that you share, and also encouraging us all to be a part of the solution to really advocate for health for everybody, to make everybody's life better. Did you want to leave us with any final thoughts or words?
You can check out Melalogic at melalogic.com, melalogic.com. And thank you for having me. I look forward to hearing from each and every person who wants to reach out to me. So Avery at melalogic.com.
Fantastic. And I put a link to Melalogic in the chat. And people like they want to join with you, looking for internship opportunities. And Dr. Joy Bell, I am not going to be able to say any words. Dr. Joy B is here, and she says she's a great fan of your work. Keep going, and thank you for your service. It really does take a vision. I totally agree with our participants. Thank you so much for joining us, everyone, and thank you, Avery, for the work that you do and the impacts that you are making.
Oh, you're welcome. You're welcome.
Thanks. Have a great rest of your day.
Okay, bye-bye.
Bye.